all the students who are taking admission in public health, now the first thing they keep asking me is, what are the things which are required to make a great career in public health? So today I'm going to discuss about what things you need to have to succeed in career of public health. For all the newcomers to the channel, I'm Dr. Pranav, public health scientist, author, and HOD Public Health at GE Goenka University. So let's start first the topic with what's the domain and scope of public health. So public health is about the health status and its improvement at the level of community. Individual doctors, nursing homes, hospital, they work on single patient at a time. If individual needs a regime to care, then you go to doctor, you go to hospital, you go to nursing home. But when the whole community needs healthcare transformation, then public health is required. The domain of public health includes protection, promotion, and prevention. Past 100 years and a little more, public health has been very, very active. Earlier, it was clinical care, and in Indian tradition, Ayurveda was talking about how to improve upon the infectious diseases, which was called Sankramak Rog. Now, coming to the Western tradition, so just after the advent of germ theory, it took a leverage, and then hygiene movement, public water carriage, improvement of toilets, then vaccination. Gradually, public health took shape of a movement, and now it is working such brilliantly. Imagine the condition: billions of people throughout the history of humanity died because of malaria. And now many big countries have eliminated malaria, and we are very proud to say India is also on the way to now eliminate malaria by 2030. With the effort of NVBDCP, National Vector-Borne Disease Control Program, India made great strides, and it is further making strides to achieve its target. Now, the role of all the young, brilliant, and enthusiastic minds who are joining public health is to support the public health infrastructure. So, my dear friend, as I keep saying, money is required for all the activity, but there is no joy in life if you are chasing just money. Public health is one field where you can work in community and derive the joy of transforming. Here is one domain where you can actually see the numbers improving. Every day, every month, every quarter, and every year, you can say the transformation of the community in which you are working. It gives me immense satisfaction that the villages we worked for Anemia Mukt Haryana, Dhankot, and Bondsi, they have made great improvement. The nutritional status has improved, the dietary pattern has improved, and now they are on the verge of eliminating anemia just in 6 months. Such is the power. So, the first thing that is required to succeed in public health is start enjoying being in the community. That's why I always emphasize the first week of public health program. When it starts, students should spend time in community. Students should spend time doing surveys, talking to people, canvassing good health. So the first thing that is required is having a passion and commitment towards the goal of health at community. I do never say that you shouldn't aspire for money. Of course, it is required at every step, and public health is going to be a very rewarding career monetarily. But to derive satisfaction and enjoy the life, you have to enjoy, you have to be passionate about community health. Point number two, since it is community health, it's not just about writing prescriptions and transferring it to the patient, and then pharmacists explain, and then lab technicians take the blood report. No. Here in public health, we have to talk to people. We have to convince every mother what is good breakfast. We have to convince every adolescent girl what is the meal that is required to prevent anemia. We have to convince every working professional what's the benefit of healthy breakfast, how to reduce stress, finally, how to improve productivity. We have to work in every slum and every community to work on better hygiene. We have to work with all the youth how to prevent smoking, alcohol, and drug abuses. So, every step of this involves communication. That's why I say public health, half of the force is towards communication. You need to be very passionate in communication, and to succeed in communication, you should know what you want to speak about, and you should have the conviction. If I am not convinced that everyone should take breakfast, how can I convince others to take breakfast? If I am not convinced you should take iron rich fruits, how can I convince others? If I am not myself convinced about vaccination, how can I convince others? So that way, the importance is communication, the second point, and to communicate well in public health, you need to have lot of conviction in what you want to say. Point number three, research capability. Research capability involves doing literature review to know about what work has already been done by other scientists. After doing literature review, journals, reports, white papers, books, you'll get to know what other scientists have worked, and based on that, you come up with a better design to do research yourself. You design a right tool to do survey, like selecting the different screening methods, the radiography, the blood test, or maybe questionnaire to understand the pattern in community. So then you will be doing analysis, and to do analysis you have to learn diligently how to use software. Now we are seeing in an age where IT technology is so easy, so proficient. So if you understand how to do analysis of softwares, it's very convenient and very effective to do analysis. And the fourth part is system orientation. Public health is all about implementation. It's not at all a science that does science for just itself. Every step of public health involves doing some public good. And to achieve that public good, you have to have a system view. You have to understand every aspect of implementation. Like public health is a multidisciplinary force. What does it mean? We take help from finance people to design the budget. You take help from operations people to create a plan. You have help from management people to implement all this. You take help from vector-borne disease people like entomologists coming from zoology background to do survey of insects, vectors. You take help from then microbiology people to understand the microorganisms which are infectious and how to do survey, control and understand them. Virology people to understand viruses involved in disease. Statistics people to design statistical tools. Communication and mass media communication people to design awareness campaign about different disease and health conditions. So as you see, public health results in a society cannot at all be achieved without the help of multidisciplinary team. You need public health nurses, you need public health physiotherapists, you need public health pharmacists. All the team when comes together we deliver, and to manage the all different members coming from different background as a team, you need to have a system approach, you need to have a management approach. So with this four thing, having great passion for community work, having a sincerity to communicate to society, number 2, understanding application of statistical software, and finally having a management approach. With these four things, you can become a brilliant public health professional. But still I would underline, every other skill you can learn, but your commitment comes from within. If you are committed for public health and public good, you are only bound to succeed. If you have any question, any doubt, any query regarding admission in the course or career in public health, you can contact me on WhatsApp 9910322892. This number is also provided on comment box below. You can contact on WhatsApp and get all the detail. If you like this video, share it with your friends and family. If you haven't subscribed yet, subscribe the channel and press on the bell icon. Thanks a lot. Thank you.